Hello and welcome to our channel. I'm Alexander Jimenez, and today we're going to be diving into the topic of osteoarthritis, which is a condition that affects millions of people worldwide. Osteoarthritis isn't just wear and tear, it's a disease that can significantly impact your daily life. But there's hope and help. In this video, we're going to explore the role of chiropractic care and how it plays in treating osteoarthritis, offering relief, and restoring function without invasive procedures. Whether you're newly diagnosed or seeking alternative treatment options, stay tuned as we unfold the benefits and holistic approaches of chiropractic care in managing osteoarthritis. Now let's get started on your path to better joint health and improved quality of life. Chiropractic care for osteoarthritis, understanding and managing OA holistically. Osteoarthritis, or OA for short, is a degenerative joint disease characterized by the breakdown of cartilage in the joints, leading to pain, stiffness, and decreased mobility. It is the most common form of arthritis affecting millions of people worldwide. OA typically develops gradually over time, especially in weight-bearing joints such as the knees, hips, and spine, but can also affect the hands and other joints. As cartilage wears away, bones may rub against each other, causing pain, swelling, and stiffness. The prevalence of OA increases with age, with most cases occurring in individuals over 65 years old, although younger individuals can also be affected, particularly those with joint injuries or other risk factors. The impact of OA on quality of life can be significant, as it can lead to reduced mobility, chronic pain, and limitations in performing daily activities such as walking, climbing stairs, and even basic self-care tasks. The pain and disability associated with OA can also be the result in decreased physical activity, social isolation, and depression. Furthermore, OA is a leading cause of work disability and contributes to substantial healthcare costs. Common symptoms of OA include joint pain, stiffness, swelling, and decreased range of motion. Pain is typically worse with activity and improves with rest, although it may become more constant as the disease progresses. Stiffness is often most noticeable upon waking up in the morning or after periods of inactivity, or tends to improve with movement. In advanced stages of OA, joints may become enlarged and there may be visible deformities. Overall, OA can significantly impact the quality of life of these affected individuals, highlighting the importance of early diagnosis and appropriate management strategies to minimize the symptoms and improve overall function. So let's understand what OA is. Osteoarthritis is a degenerative joint disease characterized by the gradual breakdown of cartilage in the joints, leading to pain, stiffness, and decreased mobility. This process is typically associated with aging and wear and tear of joints over time. As the cartilage deteriorates, the underlying bones may rub against each other, causing further damage and leading to the formation of what we call osteophytes, or bone spurs, along the joint margins. In addition to cartilage degeneration, OA can involve inflammation of the synovial membrane, thickening of the joint capsule, and changes in the surrounding ligaments and muscles. While OA can affect any joint in the body, it most commonly affects weight-bearing joints such as the knees, hips, and spine, as well as joints in the hands and feet. The primary difference between OA and other forms of arthritis lies in the underlying mechanisms and cause of joint damage. Unlike inflammatory forms of arthritis such as rheumatoid arthritis, or RA, and psoriatic arthritis, or PSA, which involve an autoimmune response and systemic inflammation, OA is primarily a degenerative condition driven by mechanical stress, aging, and genetic factors. While inflammatory arthritis typically presents with symmetrical joint involvement and systemic symptoms such as fatigue and fever, OA tends to affect joints asymmetrically and is characterized by localized symptoms limited to the affected joints or joint. Additionally, the pattern of involvement differs between OA and inflammatory arthritis, with OA commonly affecting weight-bearing joints and joints subjected to repetitive use or trauma. Understanding the anatomy of affected joints is essential for comprehending the pathophysiology of OA. Joints affected by OA typically consist of several key structures, including the articular cartilage, synovial membrane, joint capsule, ligaments, tendons, and surrounding muscles. Articular cartilage covers the ends of bones within the joint, providing a smooth, gliding surface for the movement and cushioning against impact. The synovial membrane lines the joint cavity and produces synovial fluid, which lubricates and nourishes the cartilage. The joint capsule surrounding the joint, forming a protective sleeve, while ligaments connect the bones and provide stability. In OA, these structures may undergo degenerative changes, leading to cartilage loss, bone remodeling, and joint deformities. This breakdown of joint integrity ultimately results in the characteristic symptoms and functional impairment associated with OA. So what are some causes and risk factors for OA? Osteoarthritis stems from a variety of causes and risk factors. Age is a primary factor, with OA becoming more prevalent in individuals, especially affecting those over 65 years old. Gender may also play a role, with women experiencing a higher rate of OA, particularly in older age groups. Genetic factors contribute to OA susceptibility, as certain genetic variations can predispose individuals to cartilage degradation and joint damage. Lifestyle choices, including obesity, can significantly increase the risk of OA development, as excess weight places added stress on weight-bearing joints. Occupations involving repetitive joint movements or heavy lifting may also contribute to joint degeneration over time. Participation in high-impact sports or activities that subject the joints to repetitive stress can also accelerate joint wear and tear, increasing the likelihood of OA. Additionally, injuries, particularly those affecting the joints, can predispose individuals to OA later in life. Metabolic factors such as diabetes, hormonal influences, or such as estrogen deficiency in postmenopausal women can affect cartilage health and contribute to OA progression. Overall, a combination of age, genetics, lifestyle factors, injuries, and metabolic influences contribute to the development and progression of osteoarthritis. Osteoarthritis is characterized by a range of symptoms that typically develop gradually over time. So what are the symptoms and how do we go about diagnosing OA? OA is characterized by a range of symptoms that typically develop gradually over time. Common symptoms include pain, which may worsen with activity and improve with rest, stiffness, particularly after periods of inactivity or upon waking in the morning, limited range of motion in affected joints, and swelling or tenderness around the joint area. The severity and frequency of these symptoms can vary depending on the extent of joint damage and individual factors such as age, activity level, and overall health. Diagnosing OA typically involves a combination of clinical assessment and diagnostic tests. During a physical examination, a healthcare provider will evaluate joint function, assess for signs and inflammation or deformity, and inquire about symptoms. Imaging studies such as X-rays are commonly used to visualize changes in affected joints, including narrowing of joint spaces, the presence of osteophytes or bone spurs, and alterations in bone density. Magnetic resonance imaging, or MRI, may be utilized to provide more detailed images of soft tissues, cartilage, and ligaments, particularly in cases where X-rays are inconclusive or additional information is needed. While blood tests are not typically used to diagnose OA, they may be ordered in order to rule out other conditions that can cause similar symptoms, such as rheumatoid arthritis or infection. Overall, a comprehensive evaluation combining clinical assessment and imaging studies is essential for accurately diagnosing osteoarthritis and guiding appropriate management strategies to alleviate symptoms and improve joint function. So what are the conventional treatments for OA? Conventional treatments for OA aim to alleviate symptoms, improve joint function, and enhance overall quality of life. Medications are commonly prescribed to manage pain and inflammation associated with OA. Non-steroidal anti-inflammatory drugs, or NSAIDs for short, such as ibuprofen or naproxen, are often used to reduce pain and swelling in affected joints. Acetaminophen may also be recommended for pain relief, particularly in individuals unable to tolerate NSAIDs due to gastrointestinal issues or other concerns. In some cases, corticosteroid injections may be administered directly into the affected joint to provide temporary relief from pain and inflammation. Physical therapy plays a crucial role in OA management by focusing on exercises to strengthen the muscles surrounding the affected joint, improve flexibility, and enhance joint stability. Physical therapists may also employ modalities such as heat or cold therapy, ultrasound, or e-stim or electrical stimulation to alleviate pain and improve joint mobility. In cases where conservative treatments fail to provide adequate relief or joint damage is severe, surgical intervention may be considered. In cases where conservative treatments fail to provide adequate relief or joint damage is severe enough, surgical intervention may be considered. Joint replacement surgery, such as total knee or hip replacement, is often recommended for individuals with advanced cases of OA who experience significant pain and functional impairment. During these procedures, damaged joint surfaces are removed and replaced with artificial components, restoring joint function and relieving pain. While conventional treatments for OA can be effective in managing symptoms and improving joint function, they also have their limitations and potential side effects. Medications such as NSAIDs and corticosteroids may cause gastrointestinal issues, cardiovascular complications, or other adverse reactions, particularly with long-term use. Surgical interventions may entail risks such as injury, infection, or prolonged recovery periods. Additionally, these treatments may not address the underlying cause of OA and may produce only temporary relief of these symptoms. Therefore, it is essential for individuals with OA to work closely with healthcare providers to develop a comprehensive treatment plan tailored to their specific goals and needs. So let's give a brief introduction into what chiropractic care is. Chiropractic care is a branch of alternative medicine focused on diagnosing, treating, and preventing musculoskeletal disorders, particularly those affecting the spine and nervous system. Chiropractors or trained healthcare professionals utilize a hands-on technique such as adjustments and other manual therapies to address joint misalignments, restore proper function, and alleviate pain. By restoring proper alignment and function to the spine, chiropractic care not only addresses immediate symptoms but also supports overall health and well-being. Chiropractic care is often viewed as part of a holistic approach to health and wellness, emphasizing the interconnectedness of the body's systems and the importance of addressing underlying causes rather than just treating the actual symptoms of the pathology at hand. Chiropractors consider factors such as lifestyle, diet, stress, and environmental influences when developing treatment plans, and recognizing that these elements can impact musculoskeletal health and overall vitality. By addressing spinal misalignments and promoting proper nervous system function, chiropractic care aims to optimize the body's stability, agility, and mobility to maintain a proper balance. This holistic approach extends beyond simple alleviation of pain or discomfort to supporting the body's optimal capacity for health and vitality. Chiropractic care offers a non-invasive and holistic approach to managing osteoarthritis by addressing joint dysfunction, reducing pain, and improving overall function. Specific chiropractic techniques used for OA may include diversified adjustments, activator methods, flexion distraction techniques, among others. These techniques are tailored to the individual needs of the patient and aim to restore proper alignment, mobility, and function of the affected joints. Central to chiropractic treatment for OA is the role of spinal adjustments, also known as spinal manipulative therapy, or SMT for short. During a spinal adjustment, a chiropractor applies a controlled force to specific areas of the spine, targeting joint restrictions or subluxations. By restoring proper alignment and movement to the spine, spinal adjustments help relieve pressure on the surrounding nerves, reduce inflammation, and promote optimal function of the affected joints. In addition to spinal adjustments, soft tissue therapies such as massage, myofascial release, and trigger point therapy may be incorporated into chiropractic treatment for OA. These therapies focus on releasing tension, improving circulation, and reducing muscle stiffness and tightness in the surrounding soft tissues. By addressing muscle imbalance and tension, soft tissue therapies can alleviate pain, improve joint mobility, and enhance overall comfort and function. Overall, chiropractic care for OA takes a comprehensive and patient-centered approach, combining specific chiropractic techniques with soft tissue therapies to address joint dysfunction and alleviate symptoms. By restoring proper alignment, mobility, and function to the affected joints, chiropractic treatment aims to support the body's natural healing processes and enhance overall well-being in individuals with osteoarthritis. So what are the benefits of chiropractic care and chiropractic treatment for OA? Chiropractic care offers several benefits for individuals with osteoarthritis, providing a holistic and non-invasive approach to managing symptoms and improving overall well-being. One significant benefit is pain relief without the use of drugs. Chiropractic techniques such as spinal adjustments and soft tissue therapies can help alleviate joint pain and discomfort by addressing the underlying joint dysfunction, reducing inflammation, and promoting proper alignment. By targeting the root cause of pain, chiropractic care offers a natural alternative to medications, minimizing the risk of adverse side effects and dependency. In addition to pain relief, chiropractic care can also improve joint mobility and range of motion in individuals with OA. Spinal adjustments and other chiropractic techniques help restore proper alignment and function to the affected joints, reducing stiffness and increasing flexibility. By promoting optimal joint mobility, chiropractic care can enhance overall joint function and ease of movement, allowing individuals with OA to engage in daily activities with greater comfort. Furthermore, chiropractic care can contribute to an enhanced quality of life for individuals with OA. By reducing pain, improving joint mobility, and addressing underlying joint dysfunction, chiropractic treatment can help individuals with OA regain control over their health and well-being. This can lead to improved physical function, increased independence, and a greater sense of overall vitality and satisfaction. By taking a holistic approach to health and wellness, chiropractic care empowers individuals with OA to actively participate in their own healing process and achieve a higher level of well-being. Chiropractic care plays a crucial role in an integrative approach to treating osteoarthritis by addressing joint dysfunction, reducing pain, and enhancing overall function. One key reason chiropractic is important in an integrative approach is the ability to complement other treatments for OA. Chiropractic techniques such as spinal adjustments and soft tissue therapies can be integrated seamlessly with conventional medical treatments, physical therapy, and other complementary therapies to provide a comprehensive and multidimensional approach to managing OA symptoms. By combining different modalities, patients can benefit from synergistic effects, maximizing the effectiveness of each treatment while minimizing potential risks and side effects. Furthermore, chiropractic care emphasizes the importance of a multidisciplinary approach to treating osteoarthritis. Chiropractors work collaboratively with other healthcare professionals, including primary care physicians, or PCP for short, orthopedic specialists, physical therapists, and nutritionists to develop individualized treatment plans that are tailored to the unique needs and preferences of each patient. This multidisciplinary approach ensures that patients receive comprehensive care that addresses not only the physical aspects of OA, but also other factors such as lifestyle, diet, and emotional well-being. By taking a holistic view of health and wellness, chiropractic care encourages a more integrative and patient-centered approach to managing osteoarthritis, ultimately leading to better outcomes and improved quality of life for individuals with this condition. So let's talk about patient education and management. Patient education and self-management are crucial components of osteoarthritis treatment, empowering individuals to take an active role in managing their condition and improving their quality of life. Chiropractors play a vital role in educating patients about OA, providing them with valuable information about the nature of the condition, its causes, and effective management strategies. This education includes discussing lifestyle and dietary recommendations tailored to each patient's specific needs and preferences. Chiropractors may offer guidance on maintaining a healthy weight, adopting an anti-inflammatory diets rich in fruits, vegetables, and omega-3 fatty acids, and avoiding inflammatory foods such as processed sugars and trans fats. By educating patients about the importance of nutrition in managing OA symptoms, chiropractors help empower patients to make informed choices that support joint health and overall well-being. Additionally, chiropractors educate patients about the importance of regular exercise and physical activity in managing OA. They may recommend specific exercises and activities tailored to each patient's individual needs and abilities, focusing on improving joint mobility, strength, and flexibility. These exercises may include low-impact activities such as walking, swimming, and less aggressive martial art forms, as well as targeted exercises to strengthen the muscles surrounding the affected joints or area. By providing patients with a personalized exercise plan and teaching them proper techniques, chiropractors help patients safely and effectively manage their own OA symptoms, reduce pain and stiffness, and improve overall joint function. Overall, patient education and self-management are essential components of OA treatment, empowering individuals to take control of their health and well-being. By educating patients about OA, offering lifestyle and dietary recommendations, and providing guidance on exercises and activities to support joint health, chiropractors play a critical role in helping patients manage their own condition and improve their quality of life. Additionally, chiropractors educate patients about the importance of regular exercise and physical activity in managing OA. They may recommend specific exercises and activities tailored to each patient's individual needs and abilities, focused on improving joint mobility, strength, and flexibility. These exercises may include low-impact activities such as walking, swimming, and less aggressive martial arts forms, as well as targeted exercises to strengthen the muscles surrounding the affected joints. By providing patients with a personalized experience plan and teaching them proper techniques, chiropractors help patients safely and effectively manage their own OA symptoms, reduce pain and stiffness, and improve overall joint function. Overall, patient education and self-management are essential components of OA treatment, empowering individuals to take control of their own health and well-being. By educating patients about OA, offering lifestyle and dietary recommendations, and providing guidance on exercises and activities to support joint health, chiropractors play a critical role in helping patients manage their own condition and improve their own quality of life. In conclusion, osteoarthritis is a prevalent degenerative condition that significantly impairs quality of life through pain and reduced mobility. Timely and accurate diagnosis is crucial in managing OA effectively, allowing for the appropriate interventions to be implemented. While conventional treatments offer symptom relief, they can often come with limitations and side effects. Chiropractic care emerges as a pivotal player in the treatment of OA, providing pain relief, enhanced joint mobility, and improving daily function through non-pharmacological means. Adopting a holistic approach, chiropractic care not only complements other medical treatments, but also focuses on overall well-being of the patient. Empowering patients through education and self-management techniques and lifestyle adjustments is a fundamental aspect of chiropractic practice. Empowering patients through education on self-management techniques and lifestyle adjustments is a fundamental aspect of chiropractic practice, fostering a proactive attitude towards managing OA. We strongly urge individuals suffering from OA to consider chiropractic care as a primary or adjunctive treatment method, given its potential for significant, holistic, and patient-centric outcomes. Looking ahead, the landscape of OA management is evolving, with chiropractic care gaining momentum and recognition as an essential element of comprehensive care strategies, paving the way for more integrative and patient-tailored approaches to the treatment of OA. Here are all the sources that we used to make this video today. Feel free to click on them, read them. They're very good reads. Some of them are long, some of them are short, some of them are from different countries such as Canada, some of them are from the US. If you're finding our videos helpful and informative in your journey to understand and seek medical treatment through chiropractic care, we invite you to join our growing community. Please follow us on our social media platforms to stay updated with the latest insights, advice, and success stories. Your support means everything to us, so if you like what you see, don't forget to like our videos and subscribe to our channel. Your engagement helps us reach and educate more people who can benefit from chiropractic care just like you. Connect with us today and become part of our health-conscious community dedicated to wellness and holistic healing. Thank you and have a wonderful day.